Pain in the neck. So I want to talk about this today. I want to talk about neck and pain and what can we do to help ourselves when we are compromised with our neck, or even sometimes when we have a chronic situation with neck pain. Okay, it's a big subject. I'm not going to cover the whole thing now, but just to open the discussion up, just to talk a little bit about some solutions, some ways of thinking, okay? So first thing, when we have neck issues, we don't go to the neck to fix it, okay? The neck muscles are very sensitive, are very gentle. They're not there for weight bearing, you know. Our head, our very, very super heavy head, human head, is sitting ultimately well aligned on top of our cervical spine. So we use those muscles in reaction to gentle, tiny, accurate head movements that are governed mostly by the eyes, okay? So that's the first giveaway is eyes. Eyes will be very useful. If we move the neck only in relation to where the eyes want to look, we right away are safer. Okay? If we look at our neck issues and do stuff with the neck, this is very unsafe. You know, if something dropped behind me and the noise make me turn my head, my eyes will go there and they will very comfortably. If I'm in neck pain, then I would do less of that, but definitely not this. Okay, not move the neck without the eyes. All right? That's the first thing. The second thing is the relationship of the neck with the rest of the spine. So the neck is part of the spine. You know, the top 7 vertebrae of the spine are the cervical spine, the neck, and as you already know, the spine is very interconnected. Okay, so when we look at parts of the spine that hurt, that have issues, we very often go to different parts of the spine, usually as far away as possible from that point, and begin to mobilize in a very comfortable way, and that influences the rest of the spine. Okay, this is a very, very useful piece of information. So the most obvious place to go to initially would be the pelvis, right? Because if the head is so far up on top of the spine, the pelvis is all the way down at the bottom. Okay, so when we go to the pelvis and begin to mobilize it, right away we do something to help the neck. And we usually do it explicitly asking to not do anything with the neck, to not mobilize the neck when we approach the pelvis or the lumbar spine. Okay, I'd like to give you some examples, so I'm going to go down to the mat and show you some things. The most obvious first thing that I'd like to mention is, especially if you're not sure, if you haven't done this work before and you want to just begin to move, lie on your back, if you're okay lying on your back, and simply begin tilting your knees left and right. Very small movements. This is one of the subtlest, gentlest things you can do, lying on the floor or on your bed, simply tilting your knees, but so softly that you can begin to pay attention to how this tilting of the knees moves your pelvis. I would not recommend to do one of those rolling the pelvis like this, because that engages a lot of the thorax, which might very quickly go to the neck. So a lot more passive, a lot more soothing and simple. And if you want to make it a little bit bigger, if you feel comfortable with making the movement bigger, if you know what you're doing, you can cross your knees and let this movement be your guide to roll the pelvis. This is the axis now, my right hip, or outside of it. And so this is a much bigger movement, still can feel very nice, again, depending on your unique situation or injury. There's the pelvic clock, which I would mention briefly, but I wouldn't go into because it's a whole lesson that I like to speak about at another time. But when we do talk about pelvic clock, if you can tell, I don't know if it's obvious enough from this angle, but when I roll my pelvis forward and back, look, this movement goes to my head immediately. So the spinal connection is very obvious. If you don't like lying on your back, you could be lying on your side. And again, I would recommend initially to keep all of this very quiet, the upper thorax, neck, and head, and only begin to move maybe your top knee a little bit forward and back. If I'm lying on the right, it will be the left knee, which in turn would mobilize, will turn the pelvis forward and back. And this little twist in the lower spine, once again, will echo very gently, will ripple very gently up into my cervical spine. I can play with variations. I can roll all of myself forward and back. That's not a negative. This could really work nicely. As long as you don't activate this part. And of course, once again, the eyes. If we sit, for example, and that's another variation on the theme, if we sit, and let's do, this is an example of a lesson, putting a hand in front of the face, connecting them in your mind, and moving together, right? This is a very clear twist in the lower spine, in the lumbar. So this, or a hand touching the head, will ensure that the head, neck, and shoulders are not going to move separately from each other. There is no differentiation between them. And this is a very useful tool. This makes sure that the only work you do is here, in the lower spine. And these are a few examples to how we approach neck injuries, and in general terms, thinking about neck and thinking about movements that help us get out of a situation that is unpleasant or painful. Play with it a little bit, see how it works for you, even if it's not a neck issue. See how this way of thinking is beginning to make sense to you, if it does. And share it with me, let me know, so we can continue the conversation. I will see you next Friday morning. Thanks for watching.